The first 24 hours of Lassa fever, what you do next determines survival. What to do immediately, how to prevent it, what contacts should do, and what all stakeholders must do. So what should happen the moment Lassa fever is suspected? First, do not ignore the symptoms. If someone has fever and weakness, especially after possible exposure to rats, rat droppings, contaminated food, or a sick person's body fluids, that person should be treated as a possible Lassa fever case until properly assessed. Second, the person should seek urgent medical care immediately. Do not start moving from chemist to chemist. Do not self-medicate endlessly at home. Do not hide because of fear or stigma. CHU notes that early supportive care improves survival, and NCDC stresses early suspicion, referral, and treatment. Third, the suspected person should reduce contact with others. Do not share bedding, cups, utensils, towels, clothing, or personal items. Anyone caring for that person should avoid direct contact with body fluids, and health workers must use proper infection prevention measures. Now, what about people who have been in contact with a suspected or confirmed case? NCDC defines a contact as anyone exposed within 3 weeks. That means household members, roommates, caregivers, health workers, classmates and colleagues assisting an ill co-worker may need follow-up. If you are a contact, do not panic but do not be careless. Monitor yourself closely for fever or other symptoms. Report quickly if symptoms begin. Avoid exposure to body fluids, wash hands regularly, and cooperate with public health teams. Now let us talk prevention. At the household level, food should be stored in rat-proof containers. Homes, hostels, staff quarters, and offices should be kept clean. Waste should be disposed of properly. Rodents should be kept away from living spaces, and people should avoid handling or eating rats. At the school level, administrators should improve sanitation, seal food storage, and support environmental cleaning. Risk communication on campus should be routine, especially in endemic states where awareness can save lives. At the workplace level, public offices should stop acting like infectious disease is only a hospital issue. Clean staff kitchens, control rodents, provide hand-washing points, train cleaners, educate workers, create simple reporting channels for suspected illness. At the health system level, facilities need rapid suspicion, testing access, triage, isolation capacity, and personal protective equipment. And for policymakers, the response must go beyond emergency speeches. They must fund surveillance, laboratory capacity, and treatment centres. They must support One Health collaboration and invest in public trust because outbreaks grow where information is weak. The final takeaway is simple. Lassa fever is dangerous. It spreads quietly. It can look like ordinary fever at first. It kills. But many deaths can be prevented through awareness, sanitation, rodent control, early care seeking, and strong public health systems. This is why Afro Health Bridge brings this message to the public. When communities understand the danger, they are more likely to act in time.